Good afternoon. My name is Rusty. I'm with Rehab Medical, and today we're going to talk about the QM series by Quickie. This is a Group 3 power mobility device. That means it has multi-functions, and we're going to go over those functions. We're going to move it into the mode. This is a full tilt. It is utilized for pressure relief. It's very important that when you have this particular feature to utilize it for 10 minutes every hour. This will significantly decrease the risk or manage the risk of the development of pressure ulcers at the seating surface interface. Going down, with the Group 3 power mobility device, there are generally multiple power features. This also has a recline, which is generally utilized in combination with a power elevating leg rest. These are not power elevating leg rest. However, it can come in two configurations for the power. It can come with the swing aways, as this one is, or it can come with a center foot platform that is elevating and articulating. That will be our most common version of this piece of equipment. As you can see, the joystick has not been powered on. This joystick has two paddles, one for speed and one to be on and off, and if you push it in the opposite direction, it is for mode change. When it comes on, you'll see that this one is started in Profile 1. Profile 1 is the slowest programmed profile in the system. The programs and profiles are in a circle, and if we change the mode by pushing down on the flapper, that's 2, 3, 4, and 5 is the highest speed profile. You can, through programming, reduce the number of profiles available to as low as one profile for mobility. The next time you push it down, it's going to go to the seating function. We can see the seat here on the joystick, and whatever is highlighted is what will move. You change that picture by doing a lateral move with the joystick, and it doesn't matter which direction laterally you push it, it will change back and forth to the different views. Generally, this would have a third view where the leg rest would actually be highlighted for power elevation and articulation of the leg rest as well. So the next switch we do for the mode should take us back to Profile 1, which is the slowest profile. So always remember, you can go fast through the profiles, and it will always take you back to 1. Or you can push this mode button and take you directly to the end of the circle. You can go here and go back to the first of the circle for Profile 1 and speed. And you see the yellow, so if I go like that, that takes it up to full rabbit. And then I'm going to go back down towards tortoise by flipping the right paddle up or down. You have the availability to do this in any of the 5 profiles that are for driving. That is an alert horn. The joystick swings away for transfer. So all of your features are going to be controlled through the joystick. The programming is set up in a circle. Each time you toggle the mode switch, it will complete this. It will go in the circle to the next item in line, and it starts with speed profile 1, which is the slowest profile, 2, 3, 4, and 5. This model has 5 speed profiles that can be limited to as many or as few as 1 speed profile by internal programming. That would require the utilization of a programmer and a technician to actually access the programming within the joystick to allow that to happen. The way we drive this is we place our hand on the side of the joystick, we capture the center of the joystick in between our thumb and our first finger, and we're going to rest our hand there, and then we're going to apply small pressures to the joystick to allow it to operate. Now we can modulate the speed by how hard we push the joystick in any direction. How do we charge this? We can charge this by plugging a charger into the end here, and it should be charged for 8 to 12 hours every night. That will allow the batteries to become fully conditioned. It will also allow for extended life of the batteries. It is important to plug it in every night when it is used daily. After 3 or 4 months of plugging it in every night, if you're going to not use it for several weeks, it is important to plug it in at least once a week and unplug it. It's very important to unplug it, as leaving it plugged in will discharge the system and ruin the batteries. This one also features a headrest, which is for holding the head in position during a tilt or recline procedure. This one can also have lateral supports for thoracic support or for lateral trunk support. The Group 3 power mobility device can be modified and adapted to the changing needs of an individual. This one is actually set up for somebody that is going to be using a sit puff, which is a different type of driving mechanism. Now we're going to talk about the armrest. The armrest on this can be adjusted for height through the cog mechanism here. That will have to be completed by a trained technician. However, if we need to lift them out of the way, we have a lever that we can release here, pull it up, flip it back and down. This allows for safe access laterally for transferring on and off of the mobility platform. To put it back in position, you line it up with the hole, push it down, and lock it in place. It's important to lock it in place. Some people require use of the end of the armrest for transfers or repositioning, and if it's not locked down, it can slip out. So with this particular model, if the batteries were to die and it would be necessary to put it into a freewheel configuration to allow it to be pushed, there is a lever on each motor which you can push down to disengage and pull up to re-engage. By pushing it down on both sides, this will allow you to freely push the wheelchair. It is not something that you would want to do on a regular basis. It is about a 375-pound wheelchair. With an individual in it, it will be 375 pounds plus the weight of the individual. Not something that we would recommend doing regularly. That is a feature just for emergencies. As you can see, the joystick is showing an error code. It says M1 brake error. And what you're going to notice is that it is dead. The joystick will not operate the wheelchair when this happens. This error code means that a brake has been jiggled or has become disengaged. So let's go back here and look at the brake on the bottom side. So this is the wheel lock, and you can see that it's clearly in the down position. If we move that up into the up position, it will allow us to clear this code. Now, as you can see that the code is still flashing even though I have cleared the brake. So what I'm going to do is turn it off and then power it back on, and that should clear the code and allow for normal operation of the joystick. Thank you for your attention, and thank you for the opportunity to allow Rehab Medical to improve your lives. Soon you will be meeting with your Rehab Medical technician. If you have any further questions or concerns, please address them with them. Thank you.